you have to heal your soul if you want to cure your cancer. Hey guys, welcome to Holistic Oncologist. This is Dr. Mani. I'm a practicing radiation oncologist, and today I want to talk to you about how if you want to cure your cancer, you have to heal your soul. And I'll get into that a little bit more. Just a little bit about me. I've been curing cancer for more than a decade. I went to medical school at UC San Diego, and then I did my specialty training at University of Texas, and then part of it at MD Anderson. And then somewhere in the middle of all that, I took a year off and did research at Columbia University. And so I'm very well versed in Western medicine and what Western medicine brings to the table. And I'm also a big proponent of Western medicine. I practice it every day. I cure cancer every day using the technology that Western medicine has brought us. But after years and years of practicing radiation oncology, I also came to realize that Western medicine doesn't have all the answers. Okay, these are things that they don't teach in textbooks. They don't teach you this in medical school. In fact, everything I'm about to talk to you about today, I haven't even read this anywhere else. These are all just things that I've come to realize over many, many years. And I came to this understanding after I started to really, really talk to my patients. I started to connect with them on a deep emotional level. I started to ask them about their life outside of clinic, about their life, about their work, about their kids, about all the stresses they faced, about all the challenges they were going through, not just about their cancer, just about their life in general. And as I did that more and more, I came to see patterns, and I came to see patterns that manifested in my patients beyond the physical level, and these were things that were affecting their outcomes. These were the things that would lead to better outcomes or worse outcomes. And once I started connecting the dots, I realized that there is things beyond the physical plane that can affect cancer outcomes. So that means, becoming cured, or your cancer coming back, relapsing, or, not being able to be cured. And I also realized that there are things beyond the physical plane that affect people getting cancer. So what does that mean? For example, lung cancer. So if you smoke cigarettes and you smoke heavily, that really increases your chances of getting lung cancer, right? But that doesn't account for all the cases of lung cancer. So where does that come from, right? So if these people are not smoking, this cancer is coming from somewhere else, right? And really, our Western medicine doesn't really have an answer for that. Of course, there's some people who have certain mutations, and we think these are the mutations that cause the cancer. But then the question is, where did these mutations come from, right? Is it just random chance, or is there something else in effect that caused these mutations? And a lot of this really comes down to, like I said, things beyond the physical plane. Some of the other examples are patients who are, I have a lot of young patients, and I see this more and more often, and now it's also becoming registered in the epidemiology data and statistics that we really have an epidemic of young patients getting cancer, and younger patients getting cancer. And again, this is something that Western medicine doesn't really have an answer for. Why are these people in their 30s or 40s getting these cancers that usually we see in people in their 50s and 60s, right? And to be honest with you, I think a lot of this has to do with our modern way of living and the stresses caused on us by our society, by the way of our life here, the anxieties we face every day, the pressures of modern life. These things really can lead to cancer. These are probably the causes of all these cancers that we're seeing in really young patients, and these are probably the reason that these patients are, going on to have outcomes that are, worse than expected. And I see a lot of that in patients who are coming and getting treatment, patients who are very anxious, um, patients who don't know how to self-regulate their nervous system. They just have a tendency to do worse. And of course, having a diagnosis of cancer is traumatic, and there are certain anxieties that come with that. Um, but those patients who can regulate their own nervous system, they have different tools in their inbox, whatever it may be, meditation, faith, prayer, big social support, um, different things, whatever way it might be. In my experience, those patients just do better. Okay, the patients who just have a lot of different anxieties that they can't regulate and they can't control, they just have a tendency to do worse. And so that's an example of something beyond our physical body affecting the outcomes in our physical body, right? One more thing that I also came to realize and understand is curing is not the same thing as healing. Okay, so I can easily cure patients. I cure many patients with radiation. Um, it's uh, it's very much doable. Many patients get cured with radiation. Many patients get cured with chemotherapy. But what I came to really realize and understand after many years and seeing patients after they've been cured is I understood that curing is not the same thing as healing. So curing just means that I can make the cancer go away. Okay? But if you don't heal the patient, the cancer can as easily come back. Okay? And it's because if you cure the cancer but you don't address the spiritual problem that caused the cancer in the first place, the cancer then can as easily come back. And I think that's why we have so many relapses. So relapse is when you declare the patient cancer free, and 2, 3, 4, 5 years later, the cancer then comes back. And there's many, many cases of that, and patients are always so confused. My cancer was gone, what happened? And now it's back. And that comes down to healing, because we cured their cancer, but we didn't heal the patient, right? We didn't really address the cause of the cancer beyond their physical body. So, lung cancer patients, if they're smoking and you cure their lung cancer, and then they keep smoking, their cancer can as easily come back. But to go one level beyond that is, why are they smoking, right? There's a reason why these patients are smoking. And it's a lot of times it's because they have sadness, they have anxiety that they're trying to self-medicate with cigarettes. They're stressed out. Of course, it's an addiction too. It's probably one of the most addictive drugs out there. So they have all these things, sadness, addiction, anxiety, that we don't address, right? They just come in, I'm going to treat your lung cancer, I'm going to cut it out, or I'm going to treat it with radiation, or I'm going to treat it with radiation chemotherapy, and then we send them off their way. And then, we wonder why their cancer comes back 2, 3 years later. In fact, we know that if patients who are smokers, they continue to smoke during their radiation treatments, the effectiveness of radiation is between 10 to 20% less, right? So of course we counsel them on quitting, and I tell every patient who smokes, if you continue to smoke, this treatment will be less effective. And we counsel them and we ask them to quit, but many times in fact, in the majority of smokers, they don't really quit. And if there was a drug that you could take tomorrow and it would increase the effectiveness of radiation by 10 or 20%, this would be considered a blockbuster, mega billion pharmaceutical drug, right? But we have this in front of us that if we get these guys to quit smoking, we can increase, lung cancer effectiveness outcomes by 10-20%. And it baffles me why we don't have more effective quitting strategies. Why doesn't the government or pharmaceutical industry put money towards that? And of course, we all know the answer, because the tobacco industry is huge, and it makes billions of dollars selling tobacco. And they have a big lobby, and they're probably in bed with the pharmaceutical companies and all that. So, yeah. Okay. So what's healing? Because if you have a diagnosis of cancer, you don't want to just be cured. You want to be healed, and you want to be healed not just in the body, but also in the soul and in the spirit. And let me give you an analogy of kind of where we end up in our adult lives. And so imagine yourself being a Rubik's Cube, and you are perfectly aligned. The colors on each side are just perfect as you see a brand new Rubik's Cube. And that's the way you are when you are born. And as your life goes on, at every turn of the way, with every turn, the colors get, mingled more and more. And then they're not really aligned. And sometimes they can go back towards being more aligned, and sometimes they go the other way. But as we go through our lives, we get more and more dismantling of the colors on each side. And when you go through cancer treatment, and once you get a diagnosis of cancer, I mean, these colors can really just go haywire, right? Because you're dealing with the diagnosis of cancer, and then you're dealing with the treatments, and then you're also dealing with whatever caused the cancer in the first place. And really the goal is to get your Rubik's Cube to the original perfect shape that you were born in. And of course, we can never be as perfect as a newborn baby, and how innocent and beautiful they are in their body and soul and spirit. But that's the goal, right? So that's the goal that we need to be striving for. And so when you get a diagnosis of cancer, the goal shouldn't just be focused on trying to get rid of the cancer. The goal should be also to try to heal your body, to try to heal your soul, heal your spirit. And that can look different for different people, right? That can be very different depending on what has happened in your life. And I don't know what that is for every different single person, but for example, if you get a diagnosis of cancer, really do a deep soul search as to if you have any things that are unreleased in your soul, any things that you need to let go of, any anger towards anyone, any hatred, any trauma that you still haven't processed. And really look at how negative emotions are affecting you on the daily. Cancer patients who have hope do a whole lot better than cancer patients who have no hope. And trying to be positive and optimistic. I know it's hard when you're diagnosed with cancer and you hear the C word, the C word, but you have to be optimistic, because if you don't think that you can beat the cancer and heal your body, then it's not going to be very likely that you're going to beat the cancer and heal your body. And that's just the truth. And we're going to have more videos on this channel exploring this topic and exploring how you can use strategies to really optimize your own chances of beating cancer and healing yourself, healing your body, healing your soul, and what that might look like for you. And I just want to end up by, I want to end the video by telling you guys a story about the first time that I really thought about how cancer could be affected by something beyond our physical plane, right? How cancer could be maybe affected by our emotions. And this was when I was in residency. I was in training, and one of my professors had built this really amazing room. It was a software hardware combination, and this is back in the day, so it was way ahead of its time. And basically, it was like some kind of a 3D projector where it would project the MRI of the patients, and then you could go and explore the fiber tracks of the MRIs, and then you would click on the fiber track, and it would tell you exactly what that fiber track did. So different fiber tracks in the brain, you know, they're mapped as to what they do and what region they are. And anyways, we had a patient that we were looking at. This was a very young patient, you know, in their 20s, who had glioblastoma. Glioblastoma is a very aggressive form of brain cancer. Usually you see it in people in their 50s and 60s. And this patient, when we were looking at this patient's MRI, clicked in that region, and that region had to do with identity. And so I thought that was interesting, and I went back and I looked at their chart, and I read that this patient had had identity issues and gender identity issues for many years. They'd attempted suicide over it because of all the issues they faced a few times. And then they were diagnosed with this cancer. And this was the first time that I saw that there might be a correlation with our feelings and our emotions and how they can affect our physical body, and that can manifest in different ways in our body. And you know, one thing that I'm seeing now, and I'm gonna predict this, is that we're gonna see an epidemic of prostate cancer in young men very soon. And I've already started to see early signs of this trend. And I think a lot of it has to do with pornography and misalignment of young men's sexual energy. And I'll explain how that can result in prostate cancers. And I want to just end this video by telling this to everybody who's watched this, how beautiful life is. You know, life is very beautiful. And we are just so fortunate to be here and to be alive, even if it's for a few years on this planet. We really need to cherish every day and every moment. And I want to just show you guys where I am right now. It's so beautiful. I can't not share this with you guys. So we're right outside of Big Bend. You can see this beautiful scenery here, beautiful sunset. And I want to show you guys where we're staying also. This is actually a cave. So this used to be a cave. It used to be a mining cave. And this has now become a place where you can come and stay in a cave. It's really cool. And anyways, just wanted to show you guys this. There's some crystals here in the walls. It's the shower. Anyways, love you guys so much. Thank you for watching, and I'll see you at the next video.